Hi, everybody, and hi to our guests just joining us, and those of you that continue to join us, we'll keep checking in. I'm Don Wood. I'm the Community and Patient Engagement Specialist at CRAN. I'm also our caregiver coach, which you'll learn something about as we talk today on some of the things that CRAN does. But for those of you that aren't familiar with CRAN, we're a national charity. We support, educate, and advocate for colorectal cancer patients and caregivers across Canada to improve the lives of those infected by colorectal cancer. We've also expanded Pan-Tumour, and part of the reason we're here tonight is to talk a little bit about that. Our upcoming biomarker conference is in 2 weeks to the day, actually, June 18th and 19th, and we hope many of you can join us and have joined us in the past. So we look forward to that. So tonight I was thinking about it all day today. I think we're absolutely blessed to hear from two people affected by cancer in different ways. And we're going to talk about our conference. We're going to talk about biomarkers. We're going to talk about testing. We're going to talk about where we're at in this whole stage with cancer overall, and where CGP, comprehensive genomic testing, and where this testing is at. I was thinking about it today, but to frame it from my own personal standpoint, I lost my brother to leukemia in 1984, my grad year in grade 12. So I always said I lived my whole life with cancer, and I never knew, and I still can't to this day imagine, and I have both my parents still. I'm fortunate enough to have them both, and we don't talk about it enough, that we lived our whole life with it. And then in 2017, my wife contracted stage 4 colorectal cancer and passed away in 2020. So in late 2017, I started giving back. She was focused on her treatment. I wanted to learn more about the disease. I hadn't learned about it when I was younger, and it was kind of a calling for me. And from there became, I always say, I make a joke, it was my full unpaid job when we were going through it. And as a caregiver, it's a completely different experience, but it became a very emotional thing and a very strong thing. It is to this day, and I say as my calling. And that's what brought me to CRAN in February, just of this year, because I so appreciate how patient and caregiver focused we are, the programs that we do, the work that we do to support patients and caregivers, and how we're driving things to make cancer eradicated for everyone. And really, that's what brought us here today. It's kind of a prelude to our biomarkers conference. And I thought really an opportunity for us to ground the conversation. And we have these two amazing people that we're about to hear from join us and are going to share their stories. And we're going to pose a few questions. We're going to talk about some stuff. Our amazing CRAN team is there in the background answering questions for you as well as things filter into you and things enter your mind that you want to enter. So we have that support behind you. So please do reach out over this next kind of 45 minutes to an hour. We'll see how we do. But the most important thing is to introduce these two people in the room. We've only met once before today. We had a great meeting last week. But I always say, once you meet somebody that's been affected with the disease and has dealt with the disease, it's like kin and you've been together. And we share the same thing. And it's much different than when you go to the hospital and you have a broken arm and you're talking to that that person sitting beside you. When you've shared cancer and you understand cancer, it's a much different thing. So I hope we can have a really open and fulsome conversation today. And I welcome you both. So with that, Corri, maybe I'll call on you first. Give us
Hey,
3 to 5 minutes. Tell us about
awesome.
yourself. Tell us about where you've been and
Mhm.
where you're at, and then we'll pass it over to Jen to do the same thing.
All right, I guess I'll jump right in.
Thank you.
I'm a 46-year-old wife to an amazing husband. He is my main caregiver, and mother to two teenage children or teenage boys, who have been rock solid throughout this whole story. And I hate the word journey, so I'm kind of playing with
Mm.
the word story. So my cancer story begins in about fall of 2021 when I was in and out of the emergency department with suspected gallbladder attacks. It was determined that my gallbladder had to go. So we started doing scans and the initial prep to get me ready for gallbladder surgery. And that is when they found a mass on my liver. Um, and it wasn't until February of 2022 that somebody told me, you have cancer. Um, So finally, in May of 2022, I had a partial liver resection. We had clean margins. Everything looked wonderful. However, we did, after some time off healing, 6 months of adjuvant chemotherapy, just to make sure that anything microscopic was dealt with. That did not work in that time. And in that time, I thought scans should be done. I did not speak up. No scans were done. And it metastasized to my I can't say that word, peritoneal lining.
Yeah.
To my abdominal lining, for search of a layman's term. So at that time, we began 16 months of chemotherapy, immunotherapy, chemo and immunotherapy together. And every time, eventually, it spread and grew. So in August of 2024, I was told that we had reached the end of the standard of care for my type of cancer, which, sorry, backtrack. I have cholangiocarcinoma, which is a rare bile duct cancer. So that in itself is a challenge, being that there's not a whole lot of research. A lot of the research dollars do go to the more prevalent cancers out there. Not that I, have any ill will towards that, because all cancer research does end up leading towards great changes. But the cancer had spread. We had reached the end of standard of care. There were no clinical trials available for me in Canada. And I was basically told, that's it. We have nothing more for you. And that's really kind of where my advocacy story begins. I was not ready to just let go. I connected with the Canadian Cholangiocarcinoma Collaborative, which I will refer to as C3 because that's obviously a mouthful. And they helped me get my oncologist on board with doing biomarker testing on my metastases. I will get more into the original biomarker testing that was done further on into the questions, but this is what really drove the change was me asking for a biopsy on my metastases, having biomarker testing done, and finding that I did have an FGFR2 fusion, which is a targetable mutation that has a Health Canada approved drug available through exceptional access. So I'm happy to say that since December of 2024, I have been on the targeted therapy with 3-month scans every 3 months, and they show either shrinkage and or stability. So kind of a rocky road with a little bit of hope at the end.
Yeah. What a great summary and story. Thank you, Corri, for grounding that and starting us off with that. Jen.
Yes, and actually, unfortunately, I have a link to cholangiocarcinoma as
Mm.
well as part of my story and kind of an instigator for the biomarker testing. I'm coming at this discussion from a caregiver perspective. So, my husband, Connor, at the age of 38, was diagnosed with stage 4 pancreatic cancer. His symptoms started in December 2021 on Christmas Eve, with just a little bit of pain in his abdomen. And because of his age and kind of lack of risks, um, the thought was that pancreatic cancer must be at the bottom of the list. It could be immune, it could be many things. And so he had about 4 biopsies over the course of the next 4 months as his health got much worse, lost quite a lot of weight, and ended up in the hospital. But there's pancreatic cancer is very sneaky. It's very hard to get sufficient tissue to diagnose. And so every single biopsy would come back inconclusive. And ultimately, when he was finally diagnosed in hospital because of pain, uncontrolled pain, it was actually the metastases to his peritoneum that identified that it was stage 4 adenocarcinoma. So that's one of the most common types of pancreatic cancer. Very rare in that age group, but we're seeing it more and more. And so that was a big shock to us. But because his health had been deteriorating so much over that period, I think we were at the stage where we were ready to just take action and hope that chemo or some type of treatment could help. At the time that the biopsy was finally done to complete the diagnosis, no one at the hospital, even though it was, you know, a large hospital, mentioned the possibility of biomarker testing. And the reason that Connor actually, he went and got a second biopsy while in the hospital so that they could do genetic testing. So full genome sequencing, meaning identifying everything in that tumor that had mutated and could be targetable. And the reason that he knew to advocate for that was because his father had passed away from cholangiocarcinoma at 75 the year before. And he had gone and done the testing, which was not standard of care. It was sort of an extra, you pay for it out of pocket, but he had to repeat it. It didn't come back. And ultimately he passed away. And so Connor knew that biomarker testing was really important on day one to inform treatment options, especially with pancreas cancer moves very quickly. Unfortunately, it is very aggressive. And so having that on day one would open doors. And it did. So fortunately, he was young. He responded very well to chemotherapy. And ultimately, because of the biomarker testing, he was able to take advantage of an off-label maintenance therapy post chemo that didn't work super well for him, but it, you know, was a bit of a holdover before he tried another chemotherapy. But ultimately, what the biomarker testing gave access to was a clinical trial of a very promising drug, which doesn't happen a lot with pancreas. And it gave Connor at least 6 months of feeling normal. So they didn't have the chemo side effects. He really got to enjoy our kids who were, you know, 2 and 4 at the time that he was diagnosed, and just felt like he was himself again. He looked like himself again. And from that experience, it was really important for him to pay it forward. He helped us, a few other patients, get on that trial, shared, you know, information about it with others, and really acted as a, I guess, emotional support as well for other patients. That's how our advocacy started, and it was together with Pancreatic Cancer North America that I've been working towards continuing his legacy by working on, you know, creating resources and opportunities for people to get access to genetic testing and clinical trials. So this was a great fit to share my story with your organization and help advocate for others to get those same opportunities. Connor ultimately passed away in October 2024 from the disease, but he was certainly, I think his oncologist said, remarkable in his response to the treatments, and his advocacy really allowed him to greatly extend his quality and the length of time that he lived and got to spend with his family.
You know, thank you both for the, you know, that opening and the rawness, and for sharing. It reminds me of myself, like back in 2017, we didn't talk about biomarkers. We didn't talk about this kind of stuff, and it was all new. And I remember distinctly, I was thinking about it today. I remember 2 years into Sherry's journey, sitting in the room with the medical oncologist, and I said, "Well, is there anything else we can do?" Because she'd extended multiple rounds of chemo, and long story, but she was always having trouble with the chemo, and we always had all kinds of side effects that were, you know, extending. An hour and a half was 9 hours. We used to chuckle in the hospital. It was never easy, and we went down multiple different lines of treatment, but we never got to have these kind of conversations. And behind the scenes, the work I was doing with trying to learn, because I didn't know anything about the disease, was I was working with different family organizations, different hospital organizations. I was doing some talking, explaining how I was feeling to the teams in Alberta at that time, so that they could better understand as well. And it took me almost 2.5 years into her experience. I'm with you, Corey. I don't use the word journey very often. I have a whole thing about that too. And I said, Doc, I've been doing this work for Alberta Health Services on the website. We're redoing the website on clinical trials. I don't know anything about clinical trials. I learned it because I'd heard the word and someone had said to me, "Hey, Don, is Sherry, available or applicable to a clinical trial?" And I remember sitting down with our medical oncologist at the time, and I said, is she available for this? And I still remember where I was seated in the room, the conversation, everything, and it was basically her tumor group isn't, it doesn't work. There isn't a trial right now available in Canada. Certainly, because we had an unbelievable medical team who I still keep in contact with to this day. And he said, but I'm willing to do whatever I can and do whatever research I can to try and find something. Because we were in those late stages, and I was grasping, she wasn't, because she was still trying to focus on getting better. But that's how I learned about new things and new things out there. But we didn't have this ability. Like, I've learned more in the last 10 minutes from you guys than I did in 3 years, only because we see so much advancement in precision oncology and what's happening in medicine these last few years. And that's why it's so important. And these conferences that we put on with global experts is so important for us to learn as patients and caregivers on what is out there, what is new. But I commend you both for not only where you've been, but for your advocacy, your self-advocacy, your awareness, and where you've been and how you've educated yourselves. I tried to do the best I could back in the day, but it was nowhere near the level you guys are at. So I commend you both for that. So thank you for that. So questions. Let's mix it up a bit. Jen, so how did the genomic testing become part of the whole process? Like, when did it come in? Did you know anything about it ahead of time? Had you heard about it? Had it been friends, family, maybe your medical team? Where did this whole thing come into your care process and what you were doing for Connor?
So it was really Connor's knowledge that it possibly could have given his father more opportunities, that he should be asking for it on day one. And it wasn't offered, but he asked to it's similar to cholangiocarcinoma, a more rare cancer. And so he wanted to be transferred to a hospital where there was specialists. And it was when he did that, he said, I want another biopsy. I don't mind having to go through that procedure again, but I want enough tissue to get it sent over for testing. And it's pretty amazing how much the patient and their caregivers have to get involved. So we had to arrange, the person's coming to pick it up with this um, cooler effectively, and then taking it to the other hospital and completing the testing. And then you're following up regularly to see, whether the results are in. So it was right away, but there was no waiting to get on chemo because, again, it's an aggressive disease. So, get on treatment right away. But this is always in our back pocket. And when I say back pocket, it was really front of mind for us to do the research and be ready to pivot. Um, but it was, so for us, it was right away because of someone else's experience, and that was important for us to share with others newly diagnosed, that do that right away. It takes time to come back. Thing I'll say is when you get that report back, it can be a little disheartening because a lot of the information on it is based on like what approved drugs are out there, targeted towards your mutations, when it's not really highlighting possible clinical trials, or, so there's a lot of research to be done, or, sharing with your oncologist or organizations that help you find trials using that information. So I think the other thing I just flag is that I wouldn't get disappointed if you get that back and it says, well, none of these are actionable, because it could be the drug that Connor ended up on the clinical trial with that clinical trial didn't exist at his diagnosis. So things move quickly. So we had to stay on top of what's available and out there and what trials exist for those patients. And it really made a mass difference to his treatment journey.
What was
I used it. Sorry.
just for the audience? So you're in a major center. in Ontario, right?
Sorry, it just cut out for 1 second.
Oh,
Sorry about that.
you're still you're in a major center in Ontario, so you had access to a major cancer center, right?
Correct.
So I'm always thinking about, what's it like for people that are rural and remote and everything else facing the same thing? Because it sounds like you guys were very much on top of it. And because of what his father had gone through, there was a lot of pre-education done and a lot of that up front. I know that that's not done. So from a timing perspective, how fast did all that come together?
Oh gosh. I mean, because he said I want another biopsy and kind of
Mm,
it had to happen quite quickly because he was in the hospital and it had to be done there. But I think it can take a lot of coordination amongst providers. And like you said, if you're more rural, it can be a little more difficult if you're not 15 minutes from a center that can do that.
yeah.
I think, and I'm no expert here, but it depends on the type of cancer because I think for cancers that are potentially less rare or already have proven targetable options, like targeted towards the mutations, it could be standard of care. So there are certain cancers where that's just done right away, and perhaps that's done no matter where you are in Canada. I think for these ones that are unfortunately becoming more common in younger age groups but aren't considered common. There is advocacy required, and I think working with organizations like C3 and Pancreatic Cancer North America, like I think there is a lot of emphasis on trying to provide equitable access,
Mhm.
because when it's not when I'm saying standard of care, that means it's covered and it's offered. In this case, it's not offered or covered, so the patient is paying out of pocket for the testing, and in some cases it goes to the US or it goes somewhere in Canada. So I think a lot of what I think Corey and I would probably be advocating for patients is how do we get these types of tests to become standard of care or to be at least offered consistently to patients, because the science is moving so quickly. Like things do come up. I'm sorry, I'm talking too much, but the last thing I'll say
No.
is there was a mutation that wasn't even on Connor's initial report
Mm,
that ultimately was determined to be targetable and became kind of one of our top two options for a clinical trial. And what I mean was it wasn't actionable, so it didn't come up. They check every mutation. There could be thousands of mutations that don't have a known cancer causing um, reason for mutating. It's the ones that they know are oncogenic or can cause cancer. And so that even changed in that period, and we were made aware of it. So not only can the science in terms of treatments change, but sometimes they realize that there's mutations that are actually oncogenic that weren't known to be.
mm. Corey, how does that differ for you or align with you? Or I'm sure there's
Um,
lots of synergies you saw along that
there
path, right?
is and there isn't. I did
Mm,
not have the knowledge in the beginning. Um, like I said, it wasn't until August of 2024, so I'm well over 2.5 years into my story before I started really advocating for myself. I knew through just reading and, lurking around cholangio Facebook groups and, visiting the foundation, like at the time, C3 hadn't been formed at my initial diagnosis, but there's the cholangiocarcinoma foundation in Utah. So, and they're one of the bigger of the cholangio groups. So their website was all about that's the first thing you have to do. So I began asking about biomarker testing fairly early on, but there's a barrier in, and I know we're getting to that later, in language. There are so many
mm,
words used interchangeably to describe um, molecular testing, biomarker testing, genomic profiling, genetic profiling. Like I was using the wrong language, and my oncologist thought I was asking for genetic testing, not molecular profiling. Um, and also, I had clean margins after so they didn't see a need for it. So my first biomarker testing was not completed until they found metastases. And I didn't even know that it was done at the time, and the results were not conveyed to me. until much later when I asked. And at that time, I was just told that there were no identified, like no targetable mutations, which is not the full story. I finally got a copy of the report, but at the time that I got the copy of that report, it was after I had done my second biopsy, found the FGFR2 mutation. And so it didn't really feel relevant. So I just kind of tucked it away. But in doing some other research, I just kind of wanted to see how things related to me. So I pulled out that report and I took a deep dive into it. And lo and behold, it says right on this report that the sample given was not sufficient to fully accurately determine if the FGFR2 fusion was present. And they recommended in June of 2023 that I have further testing to determine. And
So, yeah.
that wasn't communicated to me, and it wasn't done. And in August of 2024, I was told there were no more options when this was laying on the table, and I had to push to get molecular testing done again.
How long from kind of, because you both come into this very educated and knowing way more than I knew at the beginning. And I love that you do that because it helps with your self-advocacy and the work that you're doing with other organizations and stuff, which I think is so important. And so important that these organizations exist now and are doing this work to support patients and caregivers, because we need to find that outlet. I was told from day one too, Don, don't hit the Dr. Google button, right? And I did everything I could to avoid that. But you want to have those conversations, and you want to have that, explain everything to me at the beginning so that you have all of your options and you have that education and awareness. So from a timing standpoint, Corri, to you, there was obviously a lag, and it happened, like it seems like it was almost happenstance that you found out the way you did, and it came about.
It was.
What was the time from kind of start to begin, from the start to when all that happened, to when you had that conversation where you sat down and said, hey, we don't really know what else we can do here, and this is where we're at?
So, okay, where do you want me to start? Like,
Maybe from the very beginning, because you were like me. You said I didn't know a lot about it. It was kind
yeah.
of new to me, whereas Jen has had some family
Mhm.
experience and stuff, so went in with a different time frame and a
Yeah.
different mindset.
Mhm. So I didn't necessarily hit Dr. Google,
Mm,
but I did have access to, through my critical illness insurance, I had access to something called Teladoc Health, which provides a free virtual second opinion. And I was assigned to, so CCF, the Cholangiocarcinoma Foundation in the US, as well as C3 in Canada, will list doctors who are considered experts or more knowledgeable in the cholangiocarcinoma field. And just by chance, I was assigned to a virtual doctor, not a virtual doctor, but my virtual second opinion was assigned to a cholangio expert listed on CCF's website. So early on, I had a CCF expert provide advice on this case. So I knew I needed to ask for this, this, and this. Um, and yet I wasn't assertive enough at that time. Um, it wasn't until August of 2024 that I really got pushy and I found my footing and I found kind of a new sense of purpose in, I want others to learn from my experience and maybe have an easier time. So then I started becoming a lot more vocal, speaking to new cholangio patients. And so I've always been kind of researching. I joined the Facebook groups, and I'm not saying Dr. Facebook is the best thing, but
mm,
listening to other people with cholangiocarcinoma tell you about their experiences, you are going to learn. And, joining the advocacy groups like C3 and CCF, they have support groups. They have mentors. You're a mentor, Dawn. They have caregiver mentors. They have patient mentors. And, you know, you're going to learn, you're going to get the support you need by, that's one of the things I wish I had done a little bit more extensively in the beginning, was immerse myself in the community. And that's kind of what I recommend to all new patients. You need to do that. That's one of your first steps.
You both, you both told an incredible story about self-advocacy, and I very much did the same thing myself. I tell people to this day, and I remember standing in front of all the leadership at Alberta Health Services saying, I went in to try and break the system, to make it better, and to be selfish, because I came from a background that I had a different lens outside of the healthcare system. I didn't know anything about the disease. I didn't know anything about what we were going through. It was a numbing experience. To this day, I look back at and I go, it was 3 years that felt like it went by in 2 months. Um, and I didn't have that experience. So I became a self advocate and I tried to break the system and find those areas. Who can I go to learn? Where can I go to learn? Who can help me along the way to break those things down? And I commend you both for the self advocacy that you've done. And I think, a theme that's clearly coming out for everybody and everybody on the call is, organizations, it's no different than why I'm at CRAN now. I wish I knew what CRAN was when I was going through it, and I could have that support. And now, like you said, Corri, I'm a mentor to caregivers because I have that experience. And that sharing is so important. And I wrote it down twice today, and I live it every day, and everything we do, early and often. The sooner we do things and the more often we do things, the better it's going to be for us all. And thankfully with technology and everything else, we're having these discussions now, and it's easier to find groups. It's easier to network. It's easier to have things like this that are bringing things together. And I hope that it's a benefit to everybody on the call from hearing from your experience, because those are things you need to do early on and learn as much as you can.
And I think, Don, it's not like perfectly on topic, but it kind of gets at something that Corri said is it's in Canada, especially, like these oncologists have so many patients and they're trying to do their best for all of them, but the appointments are not very long. And you really have to go in there like organized and confident in, your questions. And there is sort of a sense sometimes that, oh, I'm taking up too much of their time, or, but I think when you do, we learn that like send the questions in advance, and she's printed them and just kind of focused on the ones that are most important. And you realize that when the doctor realizes how serious you are about this advocacy and about doing the work and participating in the trials, like there was like quite a level of respect that is gained, and they do support what you are trying to do. It's just I think we have a system where they have so many patients, it can be so hard to sit there sometimes and wait, don't leave yet, I have another question. So I think it's, you also just, I would say like anyone should keep advocating. I think one of the things Connor said was like there's never a stupid question.
No.
It's your life, so keep asking. And Corri, your story is a perfect example of that, right? You asking is you made a big difference to yourself and your family.
Yeah,
I did
definitely.
the same thing as Red Book. I still have it on my desk. The Red Book went with me everywhere with my phone, and I didn't use my phone. I didn't hit the Google button. I wrote things down, and I had 3 or 4 questions. I always called it my 8-minute meeting, this was during COVID, so you can imagine you had that thrown on top of
Right.
everything like you went through. But I would always frame the conversation at the beginning, to our medical oncologist first, because understanding the same thing, Jen, is how busy they are. Is how are you doing? Because I knew what they were going through, and with COVID and everything else. And we were 20 minutes from the cancer center. That 20 minutes felt like 5 hours and all day. So that's why, I reflected back earlier on, I can't imagine what it's like for people who are rural and remote and have to come in, spend overnight, the expenses, all the other things that go with it. And being tired after your treatment and everything else that goes with it, is just being organized enough to have those 3 or 4 questions that, can we answer this? Can we get through this? This is what we thought about the last 2 weeks. This is what we faced. What's kind of next? I think those are hugely important things. And it's what I do as a caregiver coach. Whenever I talk to anybody, the first thing I tell them is make sure you have a red book. It doesn't have to
Yeah.
be red. I always just had a red book if I like having a red book, but have that book and a pen with you, because I think that's so important. And you guys have done a great job today of doing that self-advocacy and that work behind the scenes that you need to do, both as a patient, a caregiver, a family member, whoever's involved on your care team, and sharing that with your care team because they're so passionate about your care and they're doing the best the very best they can for you in the time that they have. And that's why it's so important. But I think it's even more important now because Jen, you mentioned at the beginning of the call, it's so fast moving now. Like I look back, you don't look back in years now. You look back in months and weeks and days, and you're seeing things in the news every day that are changes and updates and what's happening. And it's upon us all, I think, to stay on top of it and to stay educated and be properly educated and share those conversations with your care team and ask those proper questions because they do have the expertise, but you have the lived expertise. And like you said, it's my body, right? So I'm going to ask this question, and you want to learn everything you can and try and break everything out. So I think that's really important. Question for you both. Um, Looking back as we've chatted here the last kind of half hour or so, and you're both, you came into it at different levels. Jen, you were, I think, really well educated going in. Corri was like me, going, I'm just hearing about this stuff for the first time. I don't really know. What do you wish you would have known before, or what can we give away to the audience and other people that are going to be faced with the disease and other people that you network with about how do you learn about testing? What is it? Corri did a great job of going, here's 5 different things I didn't know the difference was. And your oncologist was the one who said, oh, I thought you wanted your, this testing done. No, I wanted this testing done. What can we do better to educate ourselves, to educate others, and to help navigate the system? And also, like we've all talked about tonight, how do you have that conversation, that 3-question conversation like I did in my red book and going, what about CGP testing? Where are we at with this? What about going to this next level? What about, I always use the what about? It's that exhausting thing is what else is out there that we don't know about or we need to know about, and how do we learn and how can we educate others with that? And I'll throw it out to both of you, whatever you feel about that.
Can I start?
Of
For
course.
sure. Yeah,
Okay.
for sure.
So involve yourself with the advocacy groups. In
Mm.
my case, it was C3 that helped convince. They spoke to my oncologist and explained things to him. They sit in on tumor boards. They do they teach, they help educate on cholangiocarcinoma because, like you said, Jen, these oncologists have so many different patients. How can they be an expert on one rare cancer? So get your advocacy group involved. They want to help. They want to see this move forward. Because we need real world data. That's all I ever hear about. We need real world data to help move this forward. So, if you want something done and you don't know how to do it, reach out. And then other than that, I agree with Dawn. Have your little red book. I have a book, mine's green. But I keep it beside me at all times or have a note on your phone, like a notes app on your phone with questions that come up so that you are prepared for your appointment. And definitely get copies of every single. I know a lot of us have apps now where most of our test results are. If it's not in your app or that app is not available, get a copy of every single test and have it explained to you in plain language. That was one of the if I had done that multiple times, who knows where I'd be right now.
I use the analogy back in the day as I became an expert in reading lab reports, and I didn't know anything about them, but it was through self-education and everything else. And I used to, it was an interesting thing because my wife was focused on her treatment and her care. I focused on she goes, you would talk to the doctors and nurses, you understand that medicine stuff. And I didn't, but I got linear enough that I went, I keep hearing you say the same thing. And if she's okay for treatment next time, it's because of this one thing you ticked off in her lab report. Tell me about that, right? So I
Mm-hmm.
learn these things, and I tell people this day, learn those little things and what it is. Don't be overwhelmed by it all. Ask a simple question. And I loved, Corey, how you said in plain language and in lay language. And I
Mm-hmm.
was hoping we would get to that today because I'm a
Yeah.
huge fan of that. Is like, dear Mr. Smith, can you please give that to me in lay language so I understand it, and my family here with you can understand it and take it away, and then we can have a conversation. We can come back and do that, and it gives me a week or 2 weeks in between my treatment to figure out where we're at and everything else. And I think those are super important things, and
Mm-hmm.
we're getting way better at it. And technology, I think, is making us a lot better at it. But as always, there's never enough, and we always have a lot more to do.
There
Jen,
is
anything to add?
actually this is a really good segue into what one of the things I was going to say is staying one step ahead isn't right, but always be prepared
Mm.
for what will happen next, because again, you're the one driving the bus. This is you and your caregiver.
Yeah.
Mm-hmm.
Yeah.
So one of the things that we learned you could do with genetic testing, and it's completely free. I think one of the organizations we used was in Europe and one was in the US, but you can send them your genetic reports and some information on your tumor, the type of cancer, et cetera. And you will get a report in plain English of the trials in, whatever radius you've provided, that are suited to that you meet the inclusion criteria
Mm-hmm.
for. And so we did that through a US organization. And each time we said, it's been 6 months. Can you provide us a refreshed report? And it was a really, like, we also found other trials through kind of following some of the larger foundations or institutions, but it was a great way to have a starting point for a list to take to the oncologist. And that was going to be my other, especially with cancers that are more aggressive, you want kind of your 5 bullet points that you're going in.
Yeah.
You want clinical trials to be on there, because if you've just had scans or something and they say the disease is progressing, you don't always have a lot of time to pivot, and there's washout periods. There's time that you have
Mm-hmm.
to wait before you start a trial drug. And so just to keep it front of mind for them, especially if something comes up that might be relevant for you. We sort of had that as a standing discussion point. Sometimes there wasn't really a conversation, sometimes it was quite extensive or exciting. And we narrowed down that list together. But so I guess you don't have to reinvent the wheel. You don't have to do all your own research. There's a lot of organizations that are
Mm-hmm.
completely covered. There's no cost to them, that will help you narrow down the list of clinical trials and explain them in a way that's a little easier to understand than the databases the governments have.
I don't think I'm allowed to plug anything, but there are websites
Mhm.
out there
That's, yeah.
that will email you regular updates about trials and drugs that your mutations match. So
Yeah.
I'll leave it to you guys to Google.
So, yeah. So 2 questions, and the last one, I'm going to completely pivot this conversation, but a broad one like we've been talking about. So from both of your experiences, if you guys could change one thing with the access to the testing that you've had, and take a minute to think about it, what would that be, and how? And how can we tell the audience back so that they have that experience and they can have that in mind when they're considering this and they're faced with this?
I, I can tell you, if it's okay to go first, Corey.
I think we're going to have the
Absolutely.
same
Yeah.
answer, so you go ahead.
Fresh
I
of mind.
think
Yeah.
I think day one, it should be offered, like, it should be mentioned, it should be standard of care no matter what cancer you have,
Mm-hmm.
because who knows, there just could be something that's available and targeted towards your
Mm-hmm.
situation.
Yeah, I'm the same. I think there should be equitable access to it. It is completely not right that you can get it if you can pay for it. That's not how our health system works. And it's just not right. And I think having early testing, early comprehensive testing, will get patients to the right treatment sooner, which can only be a good thing.
We're going to have some very wholesome conversations about this in 2 weeks at our
Mhm.
Biomarkers Conference with experts from across the continuum. patients, caregivers, clinicians, policy experts to have exactly these conversations. So that's why I think a night like tonight is so important, to frame it, especially for us as patients and caregivers, from the perspective that we're coming at things with. So my last question to you two is out there, but what about the psychosocial impacts of what you've been through on not only yourselves but your families? I'll share briefly with this one with you guys. So when we were at we have a fancy new cancer center here in Calgary that's amazing, and I did a bunch of work on it. I'm super proud of it, and I stand there and there's a little video, and my wife and my son and I are in this video, and every time I go there I stop and I sit down and I ground myself and I remind myself of what I did and how I told people what we want as patients and caregivers as we built this cancer center. We didn't have that experience because we were still in the old cancer center, I call it. So in the old cancer center, they have these colored streams along the path. There's a red, follow the red path to systemic therapy, follow the blue path, follow the green path. And we didn't put that in the new cancer center. And I still say to this day, I don't know why we didn't do that, because especially patients that are going through treatment and stuff are coming in, they're like, I don't know where to go. And following the path is quite an easy thing. But there used to be a blue path that went to psychosocial in the Tom Baker Cancer Center in Calgary. And I walked past it all the time because I wasn't in a place where I wanted to talk about it. I wanted to share. I wanted to be emotional and be open. And about a year and a half into my wife's journey, they were doing a pilot project, and they came in and said, Dawn, we'd like to talk to you and Sherry about palliative care and end of life care and all these other kinds of quality of life issues. And she was a hard stop. Nope, I'm not ready for that. I don't want to have that conversation. So it was left to me. So I had a lot of these conversations after that she didn't even know about, where I was talking to that team. And ultimately, as things progressed for the quality of care and where we were at, it was so important that I'd had those conversations and that briefing, and I call it training, of what I was going to have to go through. And I knew what I was going to have to go through, but you still don't face it. So, my family tried to talk to me about it all the time. I would stay very stoic and, oh, everything's fine. Here's where we're at, blah, blah, blah. I didn't face it. And it probably took me 2 years after she passed for me to really have that recognition and reminder of the fact that I should have done this day one. And I'm a big fan of palliative and supportive care, and psychosocial work should be done on day one. Because for me, I can only say it for myself, for me, that would have helped me so much. And I think it would have helped her as well, and would have helped us as a team, as we called it, as a team going through it, because we would have understood things like even simple things, exercise, nutrition, all of these kinds of things that we weren't considering, because all we were focused on was treatment, treatment, treatment. Is that going to be good? And we were in that process. And once I started doing more work and kind of got more educated on the whole thing, nutrition, for one, was such an important part of everything, because she was dealing with nausea, dealing with tiredness. Once we started having those conversations and changing things, the quality of life at home became way better than it was. And for myself as well, because I tried to eat healthy and do the right things and be supportive. So yeah, to both of you, how has that been? And from a family perspective, how have you navigated that process?
I have a lot to say on that.
Mhm.
I am a huge advocate for psychosocial. If we had the funds for it, I think it should
Mm,
be part of the standard of care for a holistic treatment plan. Um, I did reach out early on to the psychosocial department in my cancer center, and I have been under care since probably um, probably since I started chemotherapy. So it
mm,
did take me like a year, but I have been under care. And I think where your wife was hard stop on talking about
mm,
certain things, I come at it from a different point of view. I think that if you get these things out onto paper, like talking about how you want your care plan to look like, how you want your end of life care to look like, what your wishes for what happens after. It's freeing. It's a weight lifted off. Then you're taking care of your caregiver because they don't have to worry about it. You're taking care of you because it's not hanging over your head. You can put it in a box and be free to move on to, happier things in life. So I think I there's lots of tools out there that help guide you through these conversations, that help you get things down on paper. And it's not like palliative care isn't just about end of life care. It's about taking care of yourself while you're experiencing cancer or, something else. But I think everybody should have some sort of psychosocial care.
Yeah.
I
Yeah.
completely agree. My sister's actually a palliative nurse practitioner.
Mm.
So we were kind of day one um, really open minded about that. And my husband's just was a very vulnerable person. So he knew he needed it. I think the biggest thing was you can't go through and endure chemo if you have uncontrolled pain and side effects. And it was unbelievable how supportive the palliative care team were. And I think the message that Corri shared that I will as well is we saw palliative on an outpatient basis while Connor was going through chemo. It wasn't like you stop chemo, it's not hospice, it's supportive care. And they could help with energy, with mood, with sleep, with pain, with nausea. And there were countless times that we were able to go to the cottage, that he was able to be home because we had that support. And I would say for the patient, but also for the caregiver's peace of
Mhm.
mind, it was a game changer. I think Connor was able to live out the life he wanted to, where he wanted to, and be home with our kids because of those teams. So I actually just had someone reach out who was recently diagnosed with a stage 4 cancer. And I said, the two things I'll say is genomic testing to open your doors and palliative so that you
Yeah.
feel like you can endure the treatments and you have a good quality of life. That's what it's all about. So I think we're all speaking the same
Yeah.
language here. And
Mhm.
I'm glad you
Absolutely.
brought that up, because any chance I can, it's like they go hand in hand. How can you go through and do all these treatments and trials that are so hard on you without all those other supports?
Mhm.
I call those people angels. And
Hmm.
I agree 100%. And that's why I brought it up, especially at the end of the conversation, because it knits back to what we're doing with the testing and what biomarker testing is all about. It's one stage and one part of what you're going through and everything else, but you need that supportive care and you need that inclusion of everything. So you have a full support network, and you're understanding everything on what you're going through, what you're about to go through. Um, no different than, your treatments are ongoing at the same time and everything else that you're facing, whether it's DI testing or whatever else happens with you along your treatment plan. And I always say things stop and start and go and everything else, and sometimes that's the most difficult thing, is that time lag in between and everything else. So I think you both have an amazing way of grounding that and dealing with that. So I commend you both on that.
Thank you.
Any final
Thank you.
comments and things you guys want to share for us in the group before we close out for the night? Because for me personally and selfishly, this has been amazing. Like I said, it's only the second time we've got to meet and talk, but I've learned so much in the last hour, and I commend you both for where you're at and what you've done. And every conversation is an important conversation. So, all of us at CRAN so much appreciated. But yeah, I'd love to hear your final comments.
I think just what the organization is doing is wonderful. I think I
Mhm.
mentioned I didn't have the appreciation for the fact that there was, pan-tumor support and research and knowledge. So it's been eye-opening with me. I think the opportunity to connect with Corri has been wonderful. We're going to speak
Yeah.
next week about how do we
Mhm.
share resources, because I think everyone in this community has the same goal across cancers. And I it's great to learn from other people and be able to help, I hope, other patients navigate things a little more easily than all of us have in the past. So it's been wonderful to meet all of you, and I'm excited to hear about things at the conference.
Yeah.
Thank you, Jen.
Yeah, I can reiterate that. It's my whole goal in sharing my story. And if you know me, you know I despise public speaking, but here I am sharing my story. And I am actually part of the patient panel for the conference in 2 weeks. So I am sharing my story because I want people that come after me to have a better experience. I want to share what I've learned. I love to share resources. And if I can make somebody else's experience better, then, that's just icing on the cake.
No, thank you for that, Corri. It's funny, my when I first started public speaking, when I was going through this, my wife said to me, I'm going through this and I'm telling people, and she got quite heavily involved with advocating, herself, and because she wanted to share her story about here's how I'm feeling, and it was more from a psychosocial standpoint. Here's how I'm feeling. This sucks. I want to tell other people about it. But she ended everything, and every time I give a talk, I end with the same thing, saying it's for those who come after us, and that's why we do it, and that's why it's so important. And I think, that's what we've gleaned here as a group today from you guys. And it's been amazing. I think we need to do this again. We're going to have to regroup with our team and stuff and talk about this and go through it. But I think only because of where we're at. It's so new and so evolving, and we're hearing so much. And I can't wait till, for everybody, June 18th and 19th, make sure you sign up for the conference, to hear from special people like Corri and Jen and what's happening overall, hearing from global experts that are leading with this, and, the work that we're doing at CRAN to support patients and caregivers, and where we're networked in with clinicians and with other organizations and stuff to make this better and to bring all this testing, live to all Canadians and make it available, because I think it's so important and I think it makes such a difference. So with that, I'll thank everybody on the call. But specifically, Jen and Corri, the last hour has been amazing. I hope for everybody that's been here in the background listening, you've heard the same things I've heard. I have a page of notes, and I wrote self-advocacy about 25 times. So that's my takeaway, and you're both experts at it, and I think you're doing an amazing job. So I can't thank you enough for joining, myself, the whole team at CRAN tonight, and taking time out of your schedules. And I wish you nothing but the very best. And thanks to everybody on the call today. I think it's been amazing. So appreciate it, and then we'll see you in 2 weeks live.
Thank you.
Good night, everybody.
Thank you, everybody.
Good night.